Hi, this is Lauren Tran, and this is my presentation over implementing a pressure ulcer prevention bundle in adult intensive care. I think it's important to maintain skin integrity in the ICU in order to prevent infection and other complications that the patient will experience. The incidence rate of pressure ulcers in the advanced care patient is 40% and increases mortality and morbidity. Pressure ulcers increases the rate of infection and the cost of hospitalization. This bundle is important. In this article, it explores the compliance of the nurses and measure how the procedures in the study used to plan and implement the intervention contributed to the RN's compliance in total and across the key elements of the bundle. It identify changes in the bundle compliance over time, and it identifies the factors that the nurses may or may not comply to the bundle. It's significant to nursing practice because it's important to enhance the recovery and prevention of skin breakdown of these patients. It's the barriers that were identified to prevent barriers to compliance of these patients were many of these patients are connected to monitors, tubing, or IV lines, and these patients may be difficult to turn because they're obese, they're immobile. There's the use of sedation, the multiple comorbidity sensitive surgical sites, and the use of vasopressors. It's important to know the proper interventions to promote skin integrity and what is needed to prevent further skin breakdown. So this bundle includes risk assessment, skin care, nutrition, reposition, support surfaces, and medical device related pressure ulcers. So to go into depth, it uses the Braden risk scale, which is this. It looks at sensory perception, moisture, activity, mobility, and nutrition. And it's important to physically assess the patient every 4 hours upon admission and every 8 hours thereafter. If there was loss of skin integrity, the nurses would check using the staging tool, noting the size, depth of any acidity that is present. Skin care, the patient would get bed bath once a day with pH balanced cleansing agent. Skin treated with topical moisture, and then exposed skin would be protected with padding and dressing. Some of the dressing and padding that can be used is a Smegleplex, hydrocolloid dressing that I've seen used, the sacral dressing that is applied on the sacrum, heel floats when the heel starts to get pink or it is at risk of skin breakdown, this would be applied. And then barrier cream, this could be used to retain moisture and only a thin layer is needed. Nutrition, it's important to assess their nutritional status, reposition every 3 hours, elevate the foot of the bed 20 degrees, if clinically permitted. Patient's heel are elevated, and drop sheets are used to transfer and lift patients. And then, if possible, the patient would be mobilized daily to sit or out of bed on a chair. And all ICU patients were managed on air mattresses. And then about the medical devices, they would be assessing around the skin underneath the medical device every 12 hours, and repositioning and securement of the NG tube and endotracheal tube would be assessed. So the findings in this paper was that 11 of the nurses that were participated in the study, 100% were full acceptance of this bundle, and 81.36 had high compliance for this bundle. The lowest element in this bundle that had lowest compliance was the risk assessment. This is kind of detrimental because, like, assessing the risk and preventing it from happening, the skin breakdown, is important to prevent future incidences or further deterioration of the skin breakdown. Over time, they were compliant as elements were gradually incorporated in their times. These nurses kind of saw other nurses practice these bundle, and they wanted to understand and be more familiar with it, so it was important for them to watch for each other, and the use of ongoing quality and education and training were provided with performance evaluations, and they were more compliant with that, and then with frequent audits and feedback, encouraged nurses to become compliant in improving their pressure ulcer prevention bundle performance. This study emphasized the importance in practicing the PU prevention bundle to promote the skin integrity of ICU adult patients. Understanding what improves the nurse's compliance to patient care strategies helps to strengthen healthcare delivery, and it also shows the effectiveness of implementing the PU prevention bundle. So the study had time periods, and the first 2 time periods there wasn't much change because the nurses were just learning the bundle and applying it to the routine. But after the 3rd and 4th time points, they became more compliant, and along with the training, education, feedback, and evaluations, they were more compliant. So it's important to help minimize the issues and health concerns for the patients. The barriers of pressure ulcer can be difficult to manage, and adhere to all bundle elements. Applying strategies to prevent and treat pressure ulcers can optimize the health of the patient in the ICU.